Hi, this is Jean Seebacher, and this is for nurse NUR 3280. This is my first of two videos for our final physical assessment. So, first thing I would do is position myself in front of my patient, introduce myself. I am Jean. I'm going to be doing a full physical assessment on you today. Of course, you want to try to build that relationship with your patient because you're going to be doing a physical assessment on them. So that's the first step. So the first thing I'm going to do is inspect the hands and nails. So what I'm looking for is even color to the hands and nails, which I see the skin is an even beige color. I see that all of the nails have a nice slight rounded shape to them. I don't see any clubbing to the fingernails. I don't see any cyanosis. They all have the small half moon shape to them. The only thing I noted is just some jagged fingernails probably from being bitten. So the next thing, I'm just going to take a look at the skin in general. I'm going to inspect the skin, which I see an even beige color. I don't see any nodules. It doesn't look like there's any kind of rash. It's warm to the touch. No perspiration. It appears to be afebrile. Excuse me. So next thing I want to do is check the scalp. So I'm going to inspect the scalp. Just looking at it, I don't see any lesions. We have a even distribution of hair on the cranium and the scalp. I don't see any lesions. I don't see a rash or anything of that nature. So next I want to palpate the temporal artery. Does that hurt at all? Any pain or tenderness?
No.
Then I'm going to also palpate the sinuses. Any pain or tenderness in those areas?
No.
If there were to be any pain or tenderness in those areas, then I would do the illumination test where I would have a dark room and I would use a light to shine on those areas to see if I see any discrepancies. Next thing I want to do is look at the eyes. So, actually we're going to look at the structure of the eyes first. So I'm going to have you just look straight ahead at me if you would please. So I'm going to look at the eyebrows, which appear uniform in shape, as do the eyelids and the eyelashes. I'm just going to pull your eyelids down here. The conjunctiva is pink and moist. The sclera is white in most places. I do see a little bit of a red spot to the outer aspect of the right eye where the patient did have a retinal detachment surgery. So next I'm going to look at your corneas with my ophthalmoscope, and they appear clear and moist in color. I'm looking at the irises, which are round and blue in color. Next I'm going to check I'm going to look at the reactivity of the pupils to light. I'm going to get my flashlight going here. Okay. So I'm going to just have you look straight ahead for me. I'm just going to put your head down just a little bit. This would be preferable in a dark room, of course. I'm just going to check to see if we have reaction to the light. Both pupils are reactive to light and accommodation. I would say both pupils are 3 millimeter in size. So, next, and I forgot to mention that the corneas were flat and round also. Just gonna pause.